Assalamu alaikum, dear students. This is lecture number 1 from Grass Anatomy. The topic is Introduction to Locomotion and the Upper Limb. I am Dr. Kalim Ullah, Demonstrator, Anatomy Department, GKMG Swabi. The objectives of this lecture will be to know the extent of the upper limb, to identify the regions of the upper limb, the divisions of regions into compartments, the contents of the compartments of arm, forearm, and hand, and to describe the joints of the upper limb, and lastly, the clinical anatomy of the upper limb. A general concept about upper limb: it has a long range of mobility, ability to grasp and strike, conduct the fine motor skills. It is attached with the lower lateral part of the neck. It suspends from the trunk by muscles. It articulates with clavicle and sternum by means of STJ or the sternoclavicular joint. The region of the upper extremity or the upper limb are the pectoral, the shoulder, the axilla, the scapular region, the brachial region or the arm, the cubital fossa, the antebrachial region or the forearm, the wrist region, the carpal tunnel, and the hand. The pectoral region. The bones are clavicle, scapula, sternum, upper end of the humerus. These are the bones. The muscles are pectoralis major muscle, pectoralis minor muscle, the serratus anterior muscle, and the subclavius muscle. The blood vessels are axillary artery and axillary veins, and the associated lymph nodes. The fascia are pectoral fascia, clavipectoral fascia. The joints are the shoulder acromioclavicular and the sternoclavicular joint. The nerves are the branches of the brachial plexus. The shoulder region, the bones are the scapula, the humerus, upper end, the clavicle, and the vertebral column, and the back of the skull region. The muscles are the shoulder, the extrinsic and intrinsic muscles, and the scapulohumeral muscles. The nerves are the branches of the brachial plexus, and the blood vessels are the branches of the axillary artery. The axilla is a pyramidal structure. It is a transitional region in between the lower neck and the lateral thoracic wall and the arm region. Through it, some important structures, that is the cords of the brachial plexus, the nerves of the brachial plexus, and the vessels, they pass from the trunk to the upper limb. The arm region. The bone of the arm region is humerus. The muscles are the extensors and the flexor. The extensor is a single muscle, the triceps muscle. The flexors are the biceps brachii, the coracobrachialis, and the brachialis. Both of the groups, the extensor and the flexors, are separated from each other by intermuscular septa of deep fascia. The blood vessels, it is the continuation of the axillary artery, and in this area the axillary or the artery is called the brachial artery. The cubital fossa, it is opposite to the elbow joint, and it is a transitional area in between the arm and the forearm. Through it, the various important structures, that is the nerves and the blood vessels, they pass from the arm to the forearm. The forearm is composed of two bones, the radius and the ulna. Both the radius and ulna are bound with each other by means of an intraosseous membrane. The forearm contains the extensors and the flexor muscles. The extensors are present on the back or the dorsum of the forearm, and the flexors are present on the palmar are the interior aspect of the forearm. The blood vessels are the ulnar and the uh, uh, radial artery, which are the branches of the brachial artery. The nerves are the median, the ulnar nerves for the flexor muscles, and the radial nerve for the extensor muscles. The wrist, it is the region at the junction of the forearm and the hand. It contains small bones. Collectively they are called carpus. These bones are eight in number and are arranged in four groups: the proximal and the distal. The proximal group are called the scaphoid, lunate, triquetral, and pisiform. The distal row is composed of trapezium, trapezoid, capitate, and hamate. All these bones, they form a curved shaped structure which is stitched upon by a flexor reticulum through which the tendons, the long flexor tendons and the median nerve, they pass. On the extensor surface, the extensor reticulum exists through which the long extensor tendons, they pass in the hand. The hand. The bones of the hand are called the metacarpal bones, and these are five in numbers. The muscles. The muscles of the hand are small muscles. They arise in the hand and results in the hand. The blood vessels, they form two arches, the superficial and deep arch, which supply the palm and the digits of the hand. The deep fascia forms a palmar aponeurosis, a tough, flattened sheet. The superficial fascia above the exists above the deep fascia, and it forms cushions-like structure which provide softness and the strength of grip. And the palmar spaces. The palmar spaces are the septa dips toward the metacarpal bones and divides the palm into three spaces: the thinner, the hypothinner, and the mid palmar space. We will discuss in due time later on. The digits are the fingers. The bones of the digits are called phalanges, except from thumb. The all the four fingers contain three phalanges. The thumb contains two phalanges or two bones. The blood and nerve supply are from digital branches and the small muscles. The small muscles are the intraossei and the lumbricals. They arise in the hand and inserts in the extensor expansion. The flexor creases are the creases in the hand. They present at the bony joints points. The joints of the upper limb from above downward are the sternoclavicular, the acromioclavicular, the shoulder joint, the elbow joint, the wrist joint, the intercarpal joints, the carpometacarpal in between the carpus and the metacarpal, and the metacarpopharyngeal joint, the joints between the pharynges and the metacarpal bones, and the interpharyngeal joints. Clinical anatomy of the upper limb. In the upper limb, we will also discuss the bone fracture, the broken bone, dislocation. The dislocation occurs at a point of joint. One bone dislocates from its original point. The nerve damage results in paralysis of muscles which they supply. The compression of nerve can result in problem to tear of the tendon. The carpal tunnel in which the flexor tendons they pass can also get compressed and produces symptoms. Infection in the palmar spaces can cause also difficulty, and the blood vessels damage. For example, the Walkman ischemic contracture. All these we will discuss in due time in the study of the upper limb. Dear students, it was a brief account about the introduction of the upper limb that we will study in the coming days, the gross anatomy of the upper limb. It was to orient you about the upper limb study. We will discuss the upper limb region wise and compartment wise. Inshallah, next time we will start with the regional study of the upper limb. Dear students, and last, please pray to Allah. Let there be an end to this killing COVID disease, COVID pandemic. Thank you. God may bless you all and your family. Thank you very much. Another time.